Hello, everyone, and thank you so much for joining us today. This is our second edition of Doc to Talk to, brought to you by Man Matters, India's first holistic wellness platform for men. And we're here today to discuss something affecting a lot of us these days. That is, myths around sexual performance that a majority of men believe in. These then lead to sexual performance anxiety, which in turn has a detrimental effect on our sex lives. We are very glad to have here with us today our expert, Dr. Rohit Singh, a leading psychiatrist who specializes in sexual health, who is here to bust all these myths and answer all your queries. Sexual performance anxiety is one of the most common problems that patients come to him with, and he's very keen today to clear all of these misconceptions for all of you watching the webinar. Dr. Rohit, welcome to the session.
Thanks a lot, Keith. I'm very glad to be here, and a very, very good evening to all the viewers.
Great. Doctor, could you just tell our viewers what is the session going to be about and why is it critical for our users to stay tuned today?
See, sexual performance anxiety is a very common thing and a very common presentation that I see a lot of my patients coming with. And sex happens to be a very important component of any relationship. So friction there can, transpire into friction in the relationship as a whole also. So that's why we all need to understand the basis of all what is going on with our sex lives. And these myths need to be busted big time if we are to have a smooth negotiation and smooth navigation.
Fair, Doctor. Thank you so much for setting the context. Everybody who's watching in, please note that this is a live session and all of you can give your questions on the chat. We'll be picking up questions from the chat throughout the length of the session. So, Doctor, let's start from the beginning. What this session is going to be all about and why is it going to be critical for our users to stay in? And
Yeah,
once
as I
we
said,
so what does sexual wellness really mean, Doctor?
see, sexual wellness is a very broad terminology, but something that I would want to really emphasize on is it's just holistically the mental, physical, as well as social well-being in context of sexuality. There's no confined territory where you can really pinpoint what is sexual wellness, but it's just the very act of it, the very thought of it makes you feel confident of yourself and helps both the partner grow in a good relationship. That's what sexual wellness is all about.
So, Doctor, but are there any signs of a good sex life?
Oh, yes. See, the very fact that you feel good about having sex, the very fact that you feel looking forward to for a next sexual act with your partner, both of you understand each other. Both the partners are on the same page as far as one's understanding of each other's needs are concerned. We communicate well, we feel pleasurable. The very feel of the entire act and the chemistry between the two partners, this is a sign of a good sex life for which no specific number as to in terms of frequency or in terms of the duration, all this is not required. It's just that how it brings both the partners together closer in a relationship and helps the relationship flourish.
Got it. So, talking from the perspective of a man, how can men be more mindful towards their partner, Doctor?
It's very important for men to be mindful. But now, what do we mean by the term mindful? Okay, we all talk about mindfulness, but it
Yeah.
basically means, if I were to be non technical about it, it basically means being present in the here and now. You're not thinking further ahead, you're not thinking about anything in the past. It's just about this moment here. So when I talk about mindfulness, especially in terms of the male partner, it has to be that they have to understand how their female partner is responding to their advances, responding to the touch, responding to every small thing that you do. And it's not just about sticking to sexual intercourse, but it's every small move that you make, and it leads to a response in the female partner, and how well you understand those cues and pick up those cues and accordingly keep navigating. That's what is mindfulness, and being mindful during sex. Now, that's about being mindful. Now, why is it important? As I said, when you start picking those cues in the female partner, you start understanding as to which are those areas which are preferred. There are specific preferences in terms of the act itself, like as I said, in the moment. So specific preferences, you understand those cues, and you make it more often. When it's more often, the pleasure is immense, and when the pleasure is immense, the experience is wholesome. That's why it's of paramount importance that we are mindful as far as the act is concerned.
Got it. Makes sense, doctor, that why we should be mindful, especially as men towards our partners. Now, doctor, could you start by telling us, in your experience, how common is it for men to have misconceptions when it comes to sex? And how common is it for that to also affect the sexual performance in men?
It's very common for men to have misconceptions. It's much more common than we can read anywhere. Books can tell you something, but when you really in practice encounter these patients, it's so very prevalent, irrespective of the age, irrespective of the social background they come from, irrespective of the socioeconomic status they belong to. Myths and misconception with regards to sex life is immense. And that's why, when I talk to patients, the presenting problem is something, but the root of it happens to be some myth that they have been holding on to for such a long time. And that's why it's so important to bust these misconceptions, because what happens is, when you have these misconceptions, you have developed some kind of a stereotype around it. And when you try to fit in yourself in that stereotype, that's when you're asking for trouble. And then these misconceptions, these myths, have immense ability to really give rise to a lot of anxiety around performance, and that anxiety starts to hamper your sexual health, sexual performance, and then, as I said, relationship issues as well.
Got it. So, doctor, because we are talking about myths, and there are many of those myths that men believe in, what is the most common myths that you have encountered in your practice? And could you give an example of how it has actually affected your patients?
Hands down, the myth that beats every other myth is the myth around masturbation. Let me tell you, majority of my patients that I see, they have this one common myth that the amount of masturbation or amount of masturbating that they have done in their adolescence has led to the weakness of their erection, or has led to generalized weakness as far as the organ is concerned. This tends to play so hard on their mind that I would want to really discuss one of my patients who very recently I have encountered. He's a 24-year-old male who is going to be getting married in I think 2.5 months time. And the only problem is, he feels anxious that he will not be able to perform well, because he will not be able to achieve erection, just because he has masturbated excessively in his adolescent age. Now see, he's 24. This is something that he has done at the age of 15, 16, 17, and he holds on to that concept of his, which is of course a misconception. And right now he's so anxious that in 2.5 months time I am about to get married, and I think I won't be able to achieve erection because I have done so much of masturbation in the past. Now imagine the amount of anxiety he has regarding performance. So if the entire focus is on something which has happened in the past and focus on performance so much, how is he going to manage to stay in the moment there, which was so important, as I already discussed. So that's very important, because this myth around masturbation is the most common myth, and probably the most harmful as well, because it tends to be a very fertile ground for all these anxieties to then set in. So masturbation beats everything hands down.
Understood. That was pretty enlightening, doctor.
Yeah.
Now that we've discussed the most common myths, what do you think is the most dangerous myth that you've encountered in your practice? And again, it would really help if you could give an example of one of your patients who went through that myth.
Another one, which I think is very harmful, and probably the most prevalent one, is myth about the size of the organ. Now one has to really understand. See, size will always vary. We are different individuals with different body type, which we scientifically call as phenotype. So we all have different bodies, different compositions. So of course, the size of the organ, the muscles, and everything is going to be different depending upon the ethnicity, depending upon the race, which country you come from, and the kind of diet that country has, and all of that, the temperature and everything. So we are going to be very different on that. Now, on an average, even when you research a lot into this, research also says, from European countries, it's a very common figure, somewhere between 5 to 6 inches is a common size. You go to America, those figures say that something between 6 and a half inches is a normal size. Let me tell you, anything that allows for a fruitful, comfortable, penetrative sex is normal size. Now, that can be as small as 3 inches, a little less than 3 inches, even in some cases. There is no specific number that we have to stick to or we have to keep a benchmark with. So anything which is allowing for a fruitful intercourse is a normal size. But people, they are very stuck at this size of the organ thing. A lot of my
True.
patients, I can't pinpoint one, but a lot of my patients, they feel, sir, my organ size is something which I'm not very confident about, and that really prevents me from being absolutely involved in the act, and I'm not confident about myself. This body image, they're so stuck at this size thing that it
Mhm.
really harms the entire process of what is to be done. Is not at all focusing on the act that he's supposed to, but somewhere else. And when there is this dissipation of energy, you really cannot channelize everything where it is supposed to go, where it's supposed to
True.
perform. So that size is a problem for people.
So, Doctor, I'll go a little bit more deeper into this topic now that we've started this topic. That a lot of men are actually insecure about their size, but is this insecurity even justified? If you can give us some stats and figures to put our minds at ease.
See, as I said, as I spoke to you about the sizes, different countries or different areas having these different average sizes. You have to understand these are average sizes. Okay,
True.
it's not a specific number. They come in a range, the mean of which is probably somewhere between 4 to 6 or 5 to 6, anything. But as you asked me that whether this is justified, I would have a big no for this. No, why? You don't really need to worry about the size, is because there is something called as micropenis. Okay, where the size is very less. It appears like a skin tag almost. In my practice, till date, I have not encountered even a single case of micropenis. The overall prevalence also, science states, is only 0.6% in population. It's not
Okay.
about the size, it's about the skill. How the organ is used is of paramount importance. How much of understanding does the couple have with each other is what is important. This
Hmm.
body image is really causing a lot of trouble. As far as you ask about females. Okay, I'll tell you something. You ask females about their preferences in size, and they are pretty candid in sharing. Now, when I say this is in reference to a couple of patients, of female patients that I was seeing. It's in reference to that they were pretty candid to share that size is not the matter. It's how you use it. Okay. In fact, bigger sizes lead to more troublesome sexual experience, more troublesome penetrative experience, which then, when the next time that encounter has to happen, they are so preoccupied with not experiencing that pain that they don't tend to enjoy this. So the lubrication does not happen because they're so anxious about this. Hence, being stuck with the size is not what is important. How pleasurable you can make the experience that you can make for your female partner is something that you must be concentrating on. So concentrate on the process. That's more important.
Got it. Doctor, before we move to the next question, we have one of the questions from our viewers who want to know that are
Uh-huh.
there any exercises that can help us with delaying climax?
Very good question. Whoever has asked this, the first thing, very good question. Yes, there are. There are. For both male as well as females. But now that we are speaking more in context of men here, I would
Mhm.
want to tell you there is one very simple exercise that everybody can do. Is you know, just imagine yourself. You try to stop urination while you are urinating. When you try to stop that, what you are doing is you are contracting certain muscles
Yeah.
which prevents the outflow of urine. Keep doing that contracting exercise, even normally, when you are just resting anywhere, doing some normal work, or just sitting and watching TV, keep doing those contractions. Get used to those contractions. Now, what these contractions do is they tend to enhance your control over the ejaculatory process. Now, in
Okay.
climax, what is happening with this? There is a lot of there is ejaculation taking place. Now, that ejaculation takes place because of involuntary contraction of certain group of muscles. Involuntary meaning not under our control. So we have to have certain amount of control over these muscles. So these exercises just try to contract those muscles as if you are trying to prevent the outflow of urine. This indirectly is going to enhance your control over the ejaculatory process, and those muscles become under your control. So you have control over ejaculation process. These exercises are very good and very good question.
Got it. So, Doctor, now that we're talking about climax time and the climax delay, often the depiction by what we see around us distorts reality. Expectations in terms of performance are set for men, which are not often biologically possible. And then this makes men feel insecure or even incompetent sometimes. Could you expose some unrealistic expectations that are set by things that are around us?
Yes, a little more elaborative. I would like to be in answering this question.
Sure, sure.
A lot of this, or these unrealistic expectations come from the exposure on the internet. Nothing that
Yeah,
I'm trying to hint at is pornography. See, it's a good thing. I am not against pornography at all. Not at all against pornography. It's a good thing. But in when you try to form those specimen, those models there, when you try to form your stereotype depending upon what you see in porn, you don't know the reality behind porn. Okay, when you go behind the scenes, there's a lot of other processes going into making a porn. Injections and waiting, and sometimes they ejaculate within during the process is going on. So the reality that is showed to people is not the real thing that is happening out there. So you cannot really expect to perform the way what is shown in the videos there. Hence, please do not try to build your stereotype upon what you see. Reality is very different. And a lot of research also has gone into interviewing these porn stars, male as well as female. And these researches also show that a lot of orgasms that are shown, a lot of duration, lasting so long, that they are not true. They're really not true because there are so many takes happening. One pawn takes about a day and a half to be shot. So that's not the reality. But people do not know these things, or these reality about porn, and hence they build up their stereotype around this and create those expectations and those load of expectations on themselves that even I have to be like that. It's not that way. It's
true.
just about concentrating on what is going to happen between you and your partner right here in this moment. So be very mindful of what's going on here, and do not place any expectation on yourself. Oh, I have to be the hero every time I perform. I have to be in entire control of the situation. No, it's a partnership game. It's definitely not entirely, the things are not on your shoulders. It's a partnership game, sex
True.
or relationship. So both of you are contributing in the process, and not that one of you has to have the entire control on your own orgasm as well as the satisfaction of the partner. It's not that way. Be very realistic about it. Yeah.
Fair, Doctor. Before we move to the next question, we have one of the questions from a viewer again, that can a man's food habits affect his sexual performance? You did mention that diet also impacts it, so I think we can go a little bit more deeper about that over here.
Yes, yes. I love this question. Definitely, it can have a deterring effect also, and it can have positive effects also. There are certain habits. Well, let's not just use food habits, but also other lifestyle routines that we
That's very
follow.
good, Doctor, because one more question just came in where they asked that does smoking affect the sexual performance? So I
I
think you
was just
can
coming to that.
talk
Yeah, I
about
was just coming to that. So our lifestyle has a very important role to play as far as our sex life is concerned. All right. So let's start with diet one in one part of the answer, and the other part of the answer is going to be the substance use, not just smoking, but also alcohol. So when it comes to diet, see, please understand that obesity and sex will not go hand in hand. Understand this. So the cholesterol content, the fat content, and all of that is definitely going to hamper performance, definitely going to hamper the act itself. Because when there is central obesity and you cannot see your own organ, it is very disturbing. And also it brings about those technical aspects of the act also get hampered, because intercourse cannot happen very easily. Certain positions are not possible when it is obesity on a part. So that's why you have to understand it is definitely going to hamper. So anything which helps you maintain weight, maintain your muscularity, maintain a fit physique, is definitely going to enhance your sexual performance and enhance your sex life in general. Your body image, the confidence that you have about yourself, definitely is going to increase.
I think the doctor has dropped off in between.
Testosterone level is certain food.
Yeah,
Am I
I'll
visible
again, doctor. Yeah,
now?
you go back maybe 20-30 seconds and repeat what you said.
Yeah, I was talking about certain foods enhancing testosterone level. Testosterone is the male sex hormone which increases sexual drive, which increases sexual performance, and the entire enhancement of the experience itself. Testosterone is a very important hormone. Naturally, food can definitely increase the level of testosterone in the body without taking any supplement, any external supplement. Things like garlic, avocado, almonds, all these are definitely going to enhance the level of testosterone you have in your body. You become more muscular because of which your sex drive also increases because of good testosterone level. So these are good foods that you can have. Banana has a very positive effect on the levels of testosterone. I can tell you like 20, 30 foods in our diet which we can include on a daily basis, and it definitely boosts your performance like anything. And this is not to just enhance your confidence here or just wanting to win brownie points talking about these things. It is a proven and that these naturally occurring foods are so important to be included in your diet. Secondly, smoking, just even if you can take back this one message from the entire talk, I'll be happy. Smoking kills erection. That's it. If I have to cut a long story short, smoking is going to definitely kill your erection. Let me just take a few minutes to explain how erection happens. Okay,
Sure.
it is, yeah, the biological process that happens behind erection is brain perceives few information, either visual or auditory or the smell or touch. All these information are processed in the brain. Then there are certain signals released through neurochemicals, and via the nerves they reach those muscles in the penis, the organ itself.
Okay.
Those muscles then they have they have blood vessels wherein blood is carried. These blood vessels expand, blood reaches inside because of the arteries, and that's how erection takes place. The width increases, the length increases. And also the venous return, the blood carried back by the veins, these veins have to get compressed so that the blood does not return back, it stays there for some time. So
Okay.
all of this is happening because of the nerves. Those nerves are carrying the signals. Now your smoking has nicotine. Your smoke has nicotine. This nicotine is very, very harmful for the health of the arteries. That's why heart related problems also are so much because of smoking. So
Okay.
nicotine causes contraction of these arteries. They cannot expand enough. Blood is not carried enough, and erection will not be adequate. In severe cases, erection will not happen at all because
Okay.
of the arterial health. Nerves also get damaged because of alcohol, high amount of sugar, high cholesterol. All this plays a very detrimental effect on erection, and smoking and alcohol and all these substance use, unhealthy lifestyle, unhealthy diet. All of this is definitely going to decrease your sexual performance for sure.
So I'd like to thank the viewers for asking this question because, Doctor, I think
Yeah.
you expressed a very, very important point, and I think you drove the point home. I'm pretty sure everybody is going to take back that one thing from this session for sure. Doctor, we did talk about a couple of unrealistic expectations that we have, and you explained to us that why it's wrong to have these unrealistic expectations, and it was a pretty good explanation that you gave there. But most men still also feel insecure that they're not able to last long enough. But how do you define what is long enough? Can you throw a little bit of light on that, doctor?
There is nothing called as long enough. There is no one size fits all. Okay, things are definitely going to vary as uh, according to your age, according to your state of mind, according to the circumstances, according to the equation between the two partners. A lot of factors go into this. A lot of factors. As far as let's stick to duration right now.
Sure.
If I were to mention certain numbers, so- some research will tell you ki, about 5 to 6 minutes is adequate, or somewhere between 7 to 8 minutes is more desirable. Study also shows that duration between 13 minutes to 30 minutes, somewhere between 15 to 30 minutes, is way beyond normal expectations, and something about close to 20 lasting 20 minutes is completely an outlier. This is one data. That's a very strong data that we have. 21 minutes is an outlier. But let me tell you, I have patients who can last 25 minutes with their partners, and they still feel, oh, I'm not performing well enough, doctor. I think I'm losing it too soon. Now they're performing for 25 minutes, but they still feel they're ending it too soon. So it
Got it.
is so variable and so subjective that you cannot define it by a number. But what is more important is how fulfilling the experience is, how happy both of you are after the at the end of the act, how relaxed, how desirable is the act. That the experience in itself is the most important component here, and not the duration for which you last. Of course, yes, you do need to define something called as premature ejaculation, that is close to anything, ejaculating or reaching climax before 60 seconds, 50 to 60 seconds, and
Yeah.
that's fine enough. There is this entity called as premature ejaculation, and people do suffer for that from that, and there are treatment available. But still, 3 minutes, 4 minutes is still sufficient if you have taken into account also something called as foreplay. So when you ask women, a lot of research for men is going into how women feel about the act, so that it gives more assurance and more validation to men as to how they have to go about a sexual act. And it's not just about the minute or the duration for which they want to last or they should be lasting. Women will tell you that they require more foreplay than anything else. Okay, when 95% of their needs which men are so stuck with, needs is accomplished through a very good and innovative foreplay. Concentrate on that. It's not just about penetrative sex. So it's not about how long you're lasting, but how well the act is going. And holistically looking at it is so very important, rather than just being very stuck at penetration. So yeah,
Perfect.
duration is something which you should not be bothered about.
That again brings in the point that you were mentioning earlier about being mindful about the act itself and the other things that constitute towards the act instead of just the sexual intercourse itself.
Hmm.
So, Doctor, I'd like to take another interesting question that has come up from one of our viewers. Is that it's something that affects most of us. The question is that will does irregular sleeping habits and stress hamper sexual performance? And I think you can also club it with the next question, which says, will working out regularly help to improve performance? If you can discuss about these two questions.
Let's break it into two parts. I'll tackle sleep first and then workout part of it. Sleep is going to hamper big time the performance. Now, why do I say this? Decreased sleep is going to lead to a lot of stress on the body. Now, stress is associated with release of all these stress hormones, cortisol. When you have these hormones called cortisols in your blood at high levels circulating in your blood, these are definitely going to hamper the erection process. 110%. These hormones are very detrimental to the health, to the vascular health of the body entirely. And this vascular, when I say vascular, it means blood vessels. Blood vessels are there everywhere in the body, and these blood vessels are carrying blood to the organ of sex also. So when this, because of this stress hormone, this vascular health is not maintained adequately, definitely the blood supply to the organ is going to get affected. When the blood supply is getting affected, your The strength of erection, duration of erection, or even the start initiation of erection will become a problem. Decreased sleep is a very important risk factor for your health overall, but in particular your sexual health also in terms of erection and all of that. Also, decreased sleep. If there is so much of stress going on because of that decreased sleep, you are definitely not interested enough
True.
in the act also. So it is definitely going to hamper your desire levels also. You're not looking forward to the sex or to the act anymore. So of course, your irregular sleeping habits definitely is going to hamper your sexual health. Second part, of course, is related to workout. Definitely working out regularly, even moderate levels of activity is sufficient for you to have a good health overall. Also, your sexual health is definitely going to boost up. That's because, as I said, our lifestyle is so important to maintain this vascular health, and this is your muscularity and your physique and your fitness and all of this. Your fat component in the body, all of that is under control, and definitely your blood supply and your erection and all of that goes high. If I have to cut this short, just remember one thing: anything which is good for the heart is definitely good for the penis.
Right.
Anything which is going to be bad for the heart is going to be bad for the penis, because both of them bank so much upon blood supply and bank so much upon arterial supply, that anything which is good for the artery is definitely good for sexual health and your cardiac health. Anything which is bad for your cardiac health is bad for your sexual health also.
That's a good rule of thumb that you've given, Doctor, to our viewers. I think it will be easier for them to understand what lifestyle choices to make, what food choices to make,
Hmm.
uh, given the rule that you've just given us now. It's pretty helpful. Uh, One other interesting question I think I would like to pick up, Doctor, is what can women do to help their partners feel more confident in their sexual performance and prowess?
Women, if it's coming from a woman, I really respect this question. It's very important for even women to understand the role that they can play in alleviating this sex related stress in their male counterparts. So women definitely play a very, very important role. What women need to understand is the most important role that they play is in communication. So whatever you like, please let it be known to your male partner. Whatever you don't like, let it be known to your male partner. Your non-verbal cues are also very important when it comes to foreplay, or when it comes to uh, the sexual act, intercourse itself, the positions that you are comfortable with, the positions that you are not comfortable with. So
Mhm.
that gives a very strong cue, a lead which men can take. Okay, this is the path I have to walk. This is what she likes about me. This is what is enhancing her sexual pleasure and the experience as a whole. When you maintain this communication with your male partner, that's when they feel very comfortable and they know exactly the path they have to walk. And gradually, with practice and all that, a lot of communication, things become very smooth. And you will start to realize, even you cross a certain age where people are not expecting you to perform very well, you will discover that your sexual life is much more happening than it used to be around your marriage time or just when you recently got married. So this
Interesting.
communication on part of women, I would just say one thing: please maintain this communication for your man to perform well.
Very helpful, Doctor. And this question was indeed posted by women, so I'm
Oh,
pretty sure women would be able
very
to
happy.
learn from this as well. Uh, Now, Doctor, coming to uh, the stereotypes that we have, there's a stereotype here very often that men are more eager than women to have sex. Now, is that a myth, or should men be anxious if they don't align themselves to the stereotype, or they find themselves different from the stereotype?
Sex is one of the basic instincts animals have. We as human beings also belong to animal kingdom. We have three basic instincts that we are born with and nobody teaches us: anger, hunger, and sex. Let's understand this from evolution point of view. Okay? If this is a basic instinct, there's no reason why women will be less or more or men will be less or more in this. It is there in us as a basic instinct. There is one difference though. Women are better multitaskers, and definitely they are multitasking more than men are. Women are
Okay.
also bothered about their children, their studies, what they have eaten, what is to be done, how is the kitchen going, how is my own professional work going, family going, husband going, everything else. Men mostly, yeah, they will work, they come back home, they want to have sex, eat food, go to sleep. Okay, not against men, but that's how our society is functioning. So because women are so more preoccupied with other accessory things around and other important pursuits of life, then it does take a toll on the amount of time they can invest for sex.
Okay.
So definitely, they will take a little bit more time to prepare their body, to prepare their mind for sex. That's why I'm going to come to this point of foreplay, if time permits. Why is foreplay important from the perspective of women? But let's not answer the question who's supposed to be more active and all of that. There is no thumb rule to it. Okay, we all work in different circumstances. Okay, so even for men, it's not necessary that you have to be ready for sex all the time. There is something called a circumstantial failure. Now, what is this? We have a lot of circumstances in which sex is taking place. Probably somebody's too stressed out with work and he's not able to concentrate here on sex. Somebody is too preoccupied with the setting that is there when they are having sex. Probably it's not a very friendly setting. They have children, which you have that fear of being found out while having your act going on. So all of these circumstances also play a part as to how you were feeling about sex at this point in time. So it varies for different people, and that's why when a man is not ready, it is absolutely normal. And it's very important for their female counterpart to understand that he's probably not prepared or probably not in that zone at this point in time. So there's no such thing as men have to be always prepared or ready for sex. It's normal to not feel like having sex for a few days or for at certain periods of time. It's absolutely normal for them to not be ready.
Got it. So, doctor, you did mention about circumstances, and many times couples, because of that, can also have misalignments on how often to indulge in sex. Uh, and is there should they be worried if they don't hit a mark, that is it becoming too infrequent, or what do you think should be the right number for that?
As I said, when it comes to sex, I would really refrain from pinpointing any number because people get too stuck with that number. But yes,
Yeah.
researchers have definitely given us a lot of results in terms of this context of sexual health also, that the frequency with which we should be indulging in our sexual activity. Now, research overall throughout different continents, different countries, they do say that some anything between once or twice a week is sufficient enough. But please try and understand. I want to stress, emphasize on this to the viewers that all these numbers always are lying on a wide range, a wide
Right.
spectrum. So it's a mean that is found out in between the two extremes. So one to two, once or twice every week is what is research telling us. But there are people who once a month also, only once a month, but they're very fulfilled. They have a very fulfilling experience and they're happy being there with once a month. What's more important is how is the intimacy of the relationship as a whole and not just sexual intimacy, how well they gel along, how emotionally are they on the same page, and how much of responsibility is being shared as far as other pursuits are concerned. All of that becomes very important. And frequency is not something which can be a benchmark for deciding successful sexual health or successful sexual life of a couple. So anything between twice or once a week is definitely okay, but there are people who are even lesser in frequency. There is nothing wrong with them and they're happily married together or happily staying in a courtship or whatever. So please don't stick to a number. It's about the intimacy, it's about the experience.
Got it. So that's a very important message to all the viewers from Doctor. And he said it time and time again that do not stick to numbers or metrics inside your head, no matter what you see around you, no matter what you hear around you, because we see a lot of information pertaining to all of these things. So it's very important that we focus on the act itself, be mindful about the act and towards our partners, which I think in itself will solve 90% of the things, as Doctor had mentioned earlier. Now, Doctor, in a relationship, a lot of times men usually feel guilty or blame themselves for a suboptimal sexual performance. Uh, how important is the role of men, and should they really feel guilty when they do not have a good sexual experience?
Uh, See, I've already mentioned this that none of the partner is responsible entirely for the experience of the sexual act. As I
Yeah.
said, it's a partnership game, so both of them are just contributory. They're playing a contributory role in the experience. Okay, the male cannot entirely have the burden to satisfy the woman. Women also have to be very sure as to how well relaxed are they before the act, or how well rested are they before the act, how is their state of mind, what have they been doing the entire day of their routine. And all of that also becomes very important. What is it that she likes? Is she aware of what she likes? Has she communicated this to the partner as to what she would want him to do on her? All of this becomes very important. So whether she's reaching an orgasm or no has to be played by both of them together, both the parties together.
Got
Cannot be entirely just man handling everything. Women also play a part, as I already mentioned in one of the questions earlier, as to
Yeah.
communication is so very important in between the couple that
True.
then the act will go smoothly, and whether one reaches an orgasm or no, a lot of physiology of the body is involved in that. So let's not be very worried about that. It's not entirely a man's responsibility to make a woman orgasm. Both of them have to be on that same page, whether they are ready for it, are they equally at the desire level of it, and all of that happens. The context of the day also plays such an important role. So it's not any one partner, not just men. Not any one partner is not to be blamed if the experience is not good enough. If the experience is not good enough, I would still say look at the brighter side of it. What was it about the experience that didn't go well? Let's learn from that, and maybe next time when you have that sort of a communication and comfort in communicating to each other, the
Mhm.
you keep learning every stage, you keep learning from every experience.
Got it. So, Doctor, earlier we had mentioned about foreplay. You had mentioned about it. I would like to go a little bit more deeper into it. That, in your experience or in your research, what percentage of Indian men, in your opinion, indulge foreplay? And uh, if they do not, if it's a high percentage that does not, then what do you think is the reason for skipping it?
Let me start by saying foreplay is the hallmark. Foreplay is the most important thing. Foreplay probably is the most beautiful thing that a couple can indulge in, much more than sexual intercourse itself. Please, viewers, try and understand this point. Foreplay is an extremely pleasurable experience, is an extremely helpful experience for a fulfilling sexual experience. Please, I mean, it may sound like a cliche, but you have to understand foreplay is probably the best thing you could give to your partner. The best thing. Now, why do I say this? Why is foreplay so important? First of all, foreplay helps to really, build that sexual energy, build that sexual excitement. As slow as you can be, more pleasurable the experience is. In fact, one of the research that right now I can remember is it was about specific behaviors that women like in a sexual act. I think it was as recent as 2014 or 15, done somewhere, wherein the research was about the specific sexual behaviors women prefer. Foreplay was it topped the list by a margin, a respectable margin. And what they said is, slower the partner goes, the better it helps them to build that excitement. All right. Also, you have to understand is what foreplay does is, as I said, a lot of times women are not very readily, emotionally available or mentally available for sex, but they have to do it because the man is asking for it. Even when they are not in the mood, that people call it the mood. Men have to please pay very close attention to this. Even if the female is not in the mood, foreplay gives them that ample time to build or prepare their body and mind for sex. And the reward, I have always called foreplay like an investment. The more time you invest in foreplay, the better results you are going to get, and the better response is reciprocated by the female partner. Slower you go, you win the race. Slower wins the race. Yeah, foreplay is very, very important.
Got it. I think overall, Dr. Rohit, I think this session was extremely helpful, especially the one key message that everybody, I'm sure, would take away from this is about how not to worry about numbers and just be mindful, and communication being the most important key between partners, and that it's not just one person's responsibility, but it's a partnership, like you had mentioned. So, a lot of important nuggets that you left with us, Doctor, and I'm sure the viewers found your advice very, very helpful. Would you have any parting thoughts before we close the session, Doctor, today?
No, just a few highlights that I to summarize everything that I have said. Understand
Sure.
that sex is probably the best form of pleasure we can long for. None of the materialistic things in life is going to give you that, whether it's a big car or a huge flat or the money, bank balance, whatever it is. The pleasure that a good sexual experience can give you, nothing is going to match that. So please concentrate on the process of sex and not the outcome of it. Please stay focused on the process, which is what is mindfulness is. And
Hmm.
also understand one thing that I would want to close this with is, it's not just about sexual intercourse. Sex is an interplay of a lot of things. So please bring all those repertoire into play and not just be focused on sexual intercourse. You will enjoy the experience if you just stay in the moment there.
Got it. Thank you so much, Dr. Rohit. We'll definitely keep these precious advices that you gave us in mind. And we at Man Matters are very, very glad and very thankful to have you as an expert with us. We really hope to have you in our future sessions as well.
It will be a pleasure to be here once again, and it was really heartening, the kind of responses we were getting, and also to remind everybody that as far as your sizes are concerned and your preoccupation with size is concerned, remember that the most important 6 inches is in between the two ears, your brain. Please
Good.
let it roam freely as far as fantasizing is concerned, as far as imagination is concerned. Your sex life will blossom.
Thank you so much, Doctor. We are all going to remember this and for sure learn something out of it, Doctor. So, guys, this was our second session of Doc to Talk to. We hope you found it useful and will put all of the advice that Dr. Rohit gave us today to use. We'll be back very soon with a new topic and a new expert. In the meanwhile, you can write us to info@manmatters.com to suggest a topic that you would like us to discuss. Now, don't forget to like, comment, and subscribe to our YouTube channel, Man Matters, to get expert advice on your health and wellness. We're waiting to see you at our next webinar. Till then, stay healthy and stay safe. Thank you.